Focalin in bodybuilding, the refined focus drug, cleaner stimulation, and risks for athletes. Introduction. We've already covered Adderall, 5-ANTS, Dexedrine, Concerta, and Ritalin. Now it's time to talk about Focalin, a medication many describe as Ritalin 2.0. It's more potent per milligram, provides a targeted focus effect, and is sometimes seen by athletes as a cleaner choice compared to traditional Ritalin. But does this refinement actually make it safer, or is it just a more seductive trap for bodybuilders chasing focus and appetite control? Let's dig in. Pharmacology. How Focalin works. Substance. Dexmethylphenidate, the D enantiomer of methylphenidate, the active half of Ritalin. Mechanism. Blocks dopamine and norepinephrine reuptake, like Ritalin. More efficient. Less noise, more pure stimulant effect. Immediate versus extended release. IR, immediate release, works within 20 to 30 minutes, lasts about 4 hours. XR, extended release, works within about 1 hour, lasts 8 to 12 hours. Key difference versus Ritalin. More focused mental clarity without the jittery side effects of caffeine or Ritalin, but potentially stronger dependence risk due to potency. Why bodybuilders use Focalin. Sharper mental clarity. Many describe it as laser focus without the jittery side effects of caffeine or Ritalin. Appetite suppression. Very powerful in cutting phases, so helps athletes endure extreme caloric deficits. Precision training and posing. Because Focalin sharpens fine motor control and concentration, it's sometimes used for stage routine practice or perfecting technique. Cleaner energy than Ritalin. Less up and down roller coaster, especially with XR formulation. Contest prep survival tool. Some use it to fight fatigue, control cravings, and stay mentally locked in under high stress. Scientific and psychological effects. Studies show dexmethylphenidate produces stronger cognitive enhancement at lower doses compared to racemic methylphenidate, Ritalin. Effects include better working memory, increased reaction speed, more persistent focus on boring, repetitive tasks. Downside. Because it's more potent, misuse can quickly lead to overstimulation, anxiety, and dependency. Bodybuilding use. Dosage and timing. Not medical advice. Educational context only. Medical dose, 5 to 40 milligrams per day, depending on IR or XR. Bodybuilding use. IR, 5 to 10 milligrams pre-workout for sharp focus. XR, 10 to 20 milligrams in the morning for all-day appetite suppression plus steady energy. Risk. Higher potency equals easier to abuse, especially if redosing. Side effects and risks. Short term. Rapid heart rate, elevated blood pressure, nervousness, dry mouth, tremors. Overfocus, like tunnel vision, may ignore body fatigue signals leading to injury risk. Crash effect if IR wears off. Long term. Strong psychological dependence. Increased risk of anxiety and insomnia. Potential for neurotransmitter depletion leading to flat moods off cycle. Cardiovascular strain. Same risks as Ritalin amplified by potency. Biochemical interactions in bodybuilding. With stimulants like clenbuterol, ephedrine, and caffeine, multiplies heart strain. With anabolic steroids, may enhance aggression but raises blood pressure and cardiac load. With T3, T4 thyroid hormones, energy skyrockets, but muscle catabolism risk is amplified. On low-calorie diets, suppression of hunger and high drive increased risk of overtraining and burnout. Cardiovascular and health concerns. Focalin activates the sympathetic nervous system even more sharply than Ritalin. Risks are tachycardia, fast heartbeat, hypertension, insomnia, impaired recovery, muscle loss, In worst cases, arrhythmias or stroke, especially stacked with PEDs. Safer alternatives. For focus without heavy stimulation, modafinil, L-theanine, and caffeine. For appetite suppression, dietary fibers or medical GLP-1 agonists. For motivation in prep, structured routines and mild pre-workout stimulants like caffeine or yohimbine. Conclusion. Focalin is often marketed as the cleaner cousin of Ritalin, more efficient, smoother, and longer lasting. And for bodybuilders, that makes it tempting. Strong appetite suppression, sharp focus, and the ability to lock into training sessions with surgical precision. But stronger also means more addictive potential, higher cardiovascular risk, and deeper crashes. In bodybuilding, where the heart is already under pressure from anabolic steroids, thyroid drugs, and stimulants, Focalin isn't safer, it's just more concentrated.